How can I prevent recurrent CF infections more effectively? Preventing recurrent infections in cystic fibrosis involves a careful combination of hygiene, infection control, and medical management. Since cystic fibrosis causes thick mucus in the lungs that traps bacteria, it's essential to minimize exposure to infectious germs and keep the lungs as healthy as possible. First, practicing strict infection control is vital. Wash your hands thoroughly with soap and water often, especially before eating, after coughing, or after touching respiratory secretions. Using alcohol-based hand sanitizers can also help when soap isn't available. Avoid close contact with others who have respiratory infections or symptoms to prevent catching or spreading bacteria like Pseudomonas aeruginosa or Staphylococcus aureus. If you need to be around others with cystic fibrosis, maintaining at least a 3-foot distance is recommended. Wearing masks and gloves during healthcare visits or when doing respiratory therapies can further reduce the risk of transmission. Regularly disinfect respiratory equipment, such as nebulizers and masks, to prevent contamination. Education plays a key role. Make sure you and your caregivers understand infection prevention measures and follow them consistently. Healthcare providers should offer ongoing training tailored to your needs, emphasizing the importance of hygiene and infection control. Environmental factors also matter. Avoid crowded places, especially during cold and flu seasons, and ensure your living space is well ventilated. Good airflow helps reduce airborne pathogens that can cause infections. Staying current with vaccinations, including the flu shot and pneumococcal vaccine, is another important step. These vaccines help protect against common respiratory infections that can worsen lung health in cystic fibrosis. Regular medical checkups are essential for early detection of infections. Follow your healthcare team's advice on antibiotics and airway clearance therapies. Prompt treatment of infections can prevent bacteria from establishing long-term colonization. Techniques like chest physiotherapy and other airway clearance methods help remove mucus and bacteria from the lungs, reducing infection risk. When hospitalization is needed, it's best to be treated in specialized cystic fibrosis units or in settings that follow strict infection control protocols. This helps prevent exposure to resistant bacteria and cross-infection from other patients. By combining good hygiene, vaccination, environmental awareness, and vigilant medical care, people with cystic fibrosis can lower their chances of recurrent lung infections. These strategies are supported by guidelines from cystic fibrosis organizations and infection control experts. Remember, always work closely with your healthcare team to develop a personalized plan that fits your health needs and local infection risks.